Hello, friends. Ovarian cancer is one of the cancers which, if detected early in time and then evidence-based proper treatment is provided, that doubles up the chance of survival for the patient. And if it is left undetected, as it often happens, then the chances of survival really plummet. What are the red flags of ovarian cancer which we should be aware of? What are the risk factors which increase the chances of someone to get ovarian cancer? My name is Dr. Aviral. I'm a clinician in NHS Scotland, and I'm also a scientist by training. In this video, let us discuss about the red flags of ovarian cancer and also the risk factors of ovarian cancer in a bit more detail. Let's go. Ovaries are those small glands which are present in the reproductive system of ladies. Ovaries produce eggs, and they also produce certain hormones which maintain the reproductive system in ladies and also women health in general. They are located in the pelvis. Ovarian cancer gets missed very, very easily simply because the red flags, the signs and symptoms that it produces are so generic that it's very easy for the patient to miss, and it's also very easy for the doctors to miss. And as a result, unfortunately, by the time ovarian cancer gets detected, it's already too late. It's stage 3, stage 4, and the cancer would have already spread. So it becomes quite important that we know and understand and remember the red flags which we should be aware of for ovarian cancer. And if they are seen, then we should seek immediate medical help. The first and the foremost one, so there are roughly around 10 of these. 4 of them are quite important. And if these are seen in ladies more than 50 years of age, then seek immediate medical attention. The first and the foremost one is bloating or abdominal distension. Now, one should remember that these signs and symptoms can occur, as I said, they are generic, can occur in other conditions or even otherwise as a normal part of life. But if they are present for more than 12 days in a 30-day cycle, then that becomes a bit critical and you should be seeking medical help. And even if your doctor kind of does not take it that seriously, feel free to remind the doctor that these have been there for more than 12 days, and that could be a risk for ovarian cancer because, as I said, many doctors do not realize, do not think from that angle. So first and the foremost one is bloating. So you do feel kind of fullness in the tummy, and that persists, as I said, beyond 12 days or maybe up to 2 weeks or beyond that. So seek medical attention for it. If you lose your appetite and if you eat just a little bit of food and then you feel full, that is a sign of ovarian cancer. That could be a sign of ovarian cancer, and seek medical help to get ovarian cancer ruled out. If you feel pelvic pain in the pelvic area, which is persistent, which is in the lower abdomen area, if it is persistent and it's not going away with other, simple generic treatments, and if there is also, for example, low back pain, which is persisting, the key word is persisting beyond 12 days or 2 weeks. If this happens, then do get yourself checked up. Another red flag, which is very generic, is increased urinary frequency, which means you have to go and pass urine multiple number of times. Now, this is a very common sign of urinary tract infection, which is quite common in ladies, and that can happen quite commonly. But if despite the treatment for UTI, urinary tract infection, the frequency persists beyond 12 days, 2 weeks, as I mentioned earlier, that could be a sign of ovarian cancer. And if there are other risk factors, which I come to it towards later part in the video, if those are also there, then definitely get yourself checked up. Then the next 3 worrying signs or red flags can be seen in any woman of any age. If you see these, then do get yourself checked up as quickly as possible. The first one being unintentional weight loss. Weight loss is a good thing, as is being promoted, with all those lifestyle things. But if you're not doing anything for weight loss and you're still losing weight, do get it checked up. It could be a sign of cancer in general, but also for ovarian cancer. If you feel tired all the time, there is lethargy, there's tiredness all the time, and despite your best efforts, you're not able to improve upon it on your own, and it's persisted beyond a couple of weeks, get it checked up. That could also be a sign of ovarian cancer. If there are changes in your bowel habits, so it is again very generic, very surprising red flag. But if there are certain, if you start feeling constipated or suddenly diarrhea starts and it persists, even if you have tried taking laxatives, things to help you with the bowels, but it's not helping and constipation persists, that could be a sign of ovarian cancer, because remember, ovaries are in the same area, and that means the cancer might have could grow and cause problems with the urinary and opening your bowel habits. So if there are these three symptoms of in any age, do check with the GP or with your doctor to get ovarian cancer ruled out. The next three in the line are again a bit generic. They are less specific for ovarian cancer, but nevertheless, if they are present, do get in touch with your doctor. And the first and the foremost in that one is abnormal vaginal bleeding. Abnormal vaginal bleeding could be intermenstrual, which means that it can happen in between your periods. Or it could also be bleeding starting after the menopause has set in and you have had menopause for good months or years, and then there is some bleeding. That could be a sign of ovarian cancer. So do get yourself checked up if that is the case. If you feel nausea or vomiting or dyspepsia, your swallowing is not that great, or you feel dyspepsia, heartburn is there, then do get yourself checked up, because that could be a sign of ovarian cancer. If you suddenly start feeling shortness of breath, and that has persisted, as I said earlier, beyond 12 days or 2 weeks, that could be a sign of ovarian cancer, because remember, ovarian cancer does spread into the abdomen, and that can also cause water filled in the lungs, which can cause shortness of breath. So if these three symptoms are there, also then, although they are a bit non-specific, but still, if they are there, along with some other risk factors, which I'll come to them in a second, if they are present, then do get yourself checked up for ovarian cancer. Along with these 10 primary red flags of ovarian cancer, there are certain risk factors which can be divided into broadly five categories. First and the foremost risk factor is age. Advancing age is a risk factor, is a red flag for ovarian cancers. The risk can start above 35, but above 50, definitely the risk increases. Ovarian cancer gets detected more above 50 years of age, so roughly around 80% cases are above that age of 50, but it can happen ages less than that. So one should be aware of these symptoms, and one should definitely get checked out if there are any of those red flags. The second category of risk factors is called genetic factors. As we have talked about the same in breast cancer, there are two genes, BRCA1 and BRCA2. BRCA1 and BRCA2 genes, a mutation in them increases the risk of ovarian cancer, as it does for breast cancer. So if there is BRCA1, BRCA2 gene mutations running in the family, do get yourself checked up. If you do have those mutations, have a very high suspicion index for any of the risk factors or any of the red flags which we discussed previously. If there is a history of ovarian cancer in family members, mothers or siblings or sisters, present, even in the absence of BRCA1, BRCA2 mutations, then there is also an increased risk of ovarian cancer, and that risk increases roughly around 2.7 to 3.5 times than those who don't have a family history. If there is a history in the family of other cancers, as I said, breast cancer, bowel cancer, even prostate cancer in males in the family, that can increase your risk of getting ovarian cancer. So these were the risk factors which come under the category of genetics. After that, there's a category which we say as reproductive and hormonal factors. Remember, in the beginning, we mentioned that ovary is a key organ in the reproductive system of ladies, and it also produces hormones. All the factors which increase the number of periods in the reproductive life of a female, they increase the chances of ovarian cancer. What that means is, for example, the menarche or the start of the periods is earlier on. That can increase the number of times the lady will have periods during the reproductive cycles, and that increases the chances. Or the menopause is delayed. That is again the same reason, but that can also increase the chances of ovarian cancer. If there are no pregnancies, there are no children. So pregnancy 9 months otherwise would have prevented any period cycles happening. But if there are no pregnancies, that increases the chances of having ovarian cancer. Use of HRT slightly increases the chances of ovarian cancer, but it's only after 5 years of continuous use of it. So after 5 years, do speak to your doctor. You can take a break from it, and that does reduce the chances back. But it definitely increases the chances of ovarian cancer after 5 years of consistent use. IVF can increase the chances of ovarian cancer, but there is not clear much evidence about it as far as I know. And if there is very minuscule chance of it. But nevertheless, it is documented, so it should be mentioned that does increase the risk factor. So these are the reproductive and hormonal risk factors which can cause ovarian cancer. Then comes other medical conditions. If you have had other cancers, breast cancer, bowel cancer, that also increases your chance of getting ovarian cancer. If you have a diagnosis of endometriosis already, it is documented, that also increases the chances of having ovarian cancer. After these medical conditions, there is lifestyle risk factors. And as you know, the commonest culprit is tobacco smoking. Smoking is a risk factor for ovarian cancer also. Obesity, being overweight, that is another risk factor for ovarian cancer. So these two risk factors, as you can imagine, if we work on stopping smoking and reducing our weight, that helps us in our health in many ways, but also in ovarian cancer. Any exposure, occupational exposure to asbestos, it increases the risk of ovarian cancer. There is a little evidence of it, but use of talcum powder down below can increase the risk of ovarian cancer, and especially those talcum powders which ladies used to use 30, 40 years ago, because they used to have asbestos in them. So that increases the chances of ovarian cancer. So these were the primary factors, the risk factors, which one should keep in mind. And along with them, if you have the red flags, which were mentioned earlier on, then please have a very high suspicion of index and get yourself checked up. And that's also because, remember, ovarian cancer, when detected early, we can increase the chances of survival massively. There are certain things which can help us reduce our risk of getting ovarian cancer, and those are exactly opposite to what we discussed in the risk factors. So multiple pregnancies can increase can reduce the risk of ovarian cancer. If you use combined contraceptive pills, that can reduce the risk of ovarian cancer. Obviously, for some other reason, if you have to get your ovaries removed, that reduces the risk of ovarian cancer. So these are the things which can reduce the risk of having ovarian cancer. Once you have some doubts about getting ovarian cancer, or you have some red flags, or there is a family history, do get in touch with your doctor. There is a blood test, CA-125, that can give us an indication about ovarian cancer. If it is positive, then further tests can be done. Also, an ultrasound can also be done to check about the ovaries and if there are any issues with it. I hope this information has helped you in at least getting aware of what are the signs and symptoms. Just remember, have a very high suspicion of index for ovarian cancer. If you have these even non-specific sounding looking risk factors or red flags in you, if they persist beyond 12 days, 2 weeks, seek medical help and get yourself checked up. If you have any questions, any comments, anything to suggest, do leave them in the comment section below, and I will try my best to get back to you. Take care. Thank you.